Hey guys, my name is Kruti Kanojia. I'm the co-founder and CEO of Healthy Gamer. I work on all things mental health with the gaming community. Healthy Gamer does content, so you might have seen Twitch streams or the YouTube channel. We do Healthy Gamer coaching, which works on a lot of the subclinical issues that we see in the gaming community, emotional numbness, lack of purpose, feel like you don't have control over your life, feel lonely, as well as career coaching. Once you kind of work through that, how do you advance in the real world? How do you maintain relationships, things like that. And then we have a lovely community. We have a really robust Discord server and subreddit. And then out of kind of the nature of our work, we started the Healthy Gamer Foundation, which is a 501(c)(3) that focuses on research and advocacy for the mental health needs of young people. And we just launched the HG Institute, which helps therapists kind of do better work with this population. So really excited to chat with you guys. Looking forward to it.
Wow, it sounds amazing. We have an amazing guest for everyone. I'm so excited, and she comes very highly recommended, and we've waited quite a bit of time to get her on the show. She's very much in demand, and we're very happy to have you. Thank you so much. And I am Lieutenant Colonel Ken Crigliano. For the next 5 months, I'm Lieutenant Colonel in the Air Force. I'm an AI specialist. I'm on the President's AI Council. I'm a world-class athlete, been on Netflix, Ultimate Beastmaster, American Ninja Warrior, etc. Been gaming since I could walk. I still game. I had a brain injury, and gaming actually helped me regain control of my body and my brain. So I'm very much thankful. And that's why I'm very well connected to our guests today. And I appreciate everyone showing up. Bilal, would you please introduce yourself as well?
My name's Bilal. I'm a third-year medical student over at Western University in California. Hopefully, soon to be psychiatrist. That's the goal long term. I've always believed in the power of gaming and mental health, although there have been plenty of people around me who have disagreed, and I've always had a hard time making the case for it. And then over time, as I've accumulated more knowledge and I've started working in the space, I could definitely say a lot more about how gaming can heal and then where gaming can go wrong. And I'm very familiar with both sides as well. Long term, I see myself working in not only the mental health field, but also the gaming space, doing some combination of the two. Now, when I see Healthy Gamer, I'm very, very inspired. Because back in the day, if I told anybody about how gaming and health could intersect, people would look at me funny. And today, it's practically synonymous with Healthy Gamer. So seeing how that shift has happened, and now that I can refer all the doctors and researchers I ever talk to about gaming, and they say, I don't know what it is, I just refer them to Healthy Gamer, and it brings a lot of credibility to the field that was once highly stigmatized and unrecognized, and to some extent still is, but I hope to be doing my part in contributing to the advancement of the space.
Love that. Well, I mean, thank you so much for your service, Ken. I never know what to say. That never feels like the right thing to say, but like it's very, I don't know. There's so much more emotion behind the thank you. A very deep appreciation for what you do. And Bilal, it's so we need more good clinicians. So this is very exciting.
Mhm.
Sorry, April. I want to make sure
Yeah.
you get to introduce.
And it gets better. So
It gets
No
better.
worries,
April,
no
please.
worries. No, please don't apologize. I'm so grateful you're here. Like Ken said, we've been excited to have you on. I am April Welch. I'm the Associate Vice President for Strategic Initiatives at Illinois Tech. And I didn't start our gaming program. Our students started our gaming program, and I've been an advocate for them since 2010. And we got our official status in 2013 with our lead kiddo named Elvin Moy, who was a League of Legends player. We got our arena in 2018, and we're just trying to go to town. And like Ken said, I'm an advocate for my gamers and gamers all over. I'm doing my PhD on figuring out ways to help other administrators make the case to build these esports facilities and to build these programs that support kids mentally and physically. I'm really excited right now about the intersection between digital gaming and physical gaming. So games like Beat Saber and Halo, and there's a VR tennis that I absolutely love out of Australia with Gregor. I'm super, super stoked about the future. And like Bilal said, so many people now who used to make, make light of gaming are understanding that it is a part of people's lives. And as Ken said, it's got the power to create these superhumans. Our students and our kids are learning at astronomical rates. Their Twitch is called Twitch because their Twitch speeds are amazing. And just really leaning into getting, real research around this space and finding ways to support folks who are trying to make the case for gaming on their campuses, and in in parallel with others who are making the case for cancer research and things that are also super important. I want to be parallel. I want people to understand that having these spaces means our students finish college, means our students have resilience, our students have focus and leadership and communication and all of the things that you build in physical sports, you can build in digital sports. So I will get off my soapbox because Carrie has joined us.
Hi. Sorry I'm late. I had to do my makeup. I do have us recording here too, just as a backup. And then, are we doing introductions or am I standby?
We have
Mhm.
launched. We have
We have
launched
launched.
and we're
Okay.
recording. Yeah. So
Okay.
go ahead and do your intro, please,
Sure.
for everyone, if you don't mind.
Sure. My name is Kyrie. I'm here to change the world, and I'm going to do it one life at a time. I've done it already with the help of great people like this around me because I can't do it alone. And I'm a Air Force veteran, intelligence, special operations. Went on to have 8.5 years of rampant addiction, and then that ultimately concluded in a suicide attempt, which changed my life forever. And my whole goal is to prevent anyone from ever feeling the way I felt December 21st of 2020.
Great. Can you just do 2 sentences about our bot and what you've done with
Sure.
that so far?
So I've created a bot somehow, and it's called the Recon Care Companion. Recon Care stands for cherishing all, respecting each. You could look at it two ways. One is a glorified ticket system. Two is a 988 alternative, where it has a trained peer-to-peer support staff on the ready 24/7 to take anyone that's anywhere from feeling lonely all the way up to active crisis intervention. Now it's peer-to-peer, so it's nobody's acting in a professional capacity. So we do have Mike's doing that thing again. Dang, dude, I don't know why it's doing that. I'm sorry, y'all. I can switch to this. It's going to sound a little crusty.
No, don't worry, you're good.
I don't want to be blowing it out.
That's all right. Just
Sounds
can
good.
continue your thought process, and then we'll just rock and roll.
Sure. I do know how to fix it, and I'll fix it in a second. So it's Ken dubbed it the KME, Kyrie method of empathy, which I don't need my name on it. I just need the job to get done. And it was injected into the Reflex AI model that was brought to us by Home Team. It was a $3 million AI that somehow took my brain and made training modules based off of how I operate. And so these peer-to-peer staff have undergone that level of training, and they put aside their professional capacity because all we're offering is an ear to listen. We're not offering counsel or guidance or anything beyond just peer-to-peer support. Now, that does not mean we're not able to hand them off to resources or actively de-escalate and things of that nature, but like we don't have a duty to report or anything like that.
Right.
That's great. So please, Kruti, you dropped the nugget on you're launching an HG Institute. Is this like new? Like how new is this?
We haven't really announced it. We've kind of
Okay.
soft LinkedIn posted about it once or twice, but that's really it. Can I just say, Carrie, is it Carrie or Kyrie? Sorry.
Kyrie.
Kyrie, it's lovely to meet you. And I was telling Ken, I never know what to say exactly other than thank you for your service, but it's really a very like heartfelt emotion for just like, I can't imagine
Well, I'm sure
It's-
you can. I mean, you felt pain before. Just because we had a uniform doesn't make it so different.
That's true. And I think that's what's so astonishing about it is the amount of courage and the amount of just things that you guys go through and see and experience, and the waiting and the, I don't know, just the kind of fear of it all.
There's a lot of uncertainty.
Are just like us, and it's amazing that you guys go through that. So it's very touching and it's very emotional to kind of be able to be here with you guys. But the Institute, transitioning. So the HG Institute, what we essentially saw was that we were able to work with gamers in a similar peer-to-peer kind of way without the duty to report, without kind of it not being clinical. We were able to make such tremendous impact, and so many of the people we worked with were coming out of really bad experiences working with a therapist, or just therapist shortages and what have you. That we said, you know what, if there's validity to the methodology here, not just like the way we do things, but the things that we know that might be lacking in what traditional therapist training looks like, how do we make that more accessible? Our whole kind of MO here is AOE healing. So it's never just single target for us, right? It's very like, what is the ripple effect? How do we kind of create that the biggest bubble possible? And we thought, well, hell, if we can arm therapists with more tools, more techniques, more knowledge, let's do that. So that's where the Institute was born, and it was just accredited by the Psychological Association and the Social Worker Board. So it's really great to be able to start working, spreading that into the clinical atmosphere as well.
Wow. Can you break that down for folks who are not like in the know
Sure.
on these industries? And like, I'm a regular guy, just game, got my things going on. Can you just
Yeah.
tell me what that means?
Sure. It's one of those, if you've ever had a moment where you're like, I cannot believe this is the way the world works, but I cannot believe this is the way the world works, right? So the way therapists are trained, first of all, it's all state regulated. So an LPC, a licensed professional counselor in the state of Texas, cannot diagnose somebody with a mental health diagnosis, which is not the same as in other states. In other states, an LPC can diagnose. So there's state line barriers to what different people with the same credentials can and cannot do. And then on top of that, there's like maybe 6 different types of therapists. There's a licensed marriage and family therapist, there are social workers, there are PhD psychologists, and there are psychiatrists. So the therapy landscape is very complex, in the type of licensure and then the type of regulation that is imposed on top of that. So all of that makes it very daunting for somebody to say, hey, let's make therapy better. Because are you working with the state? Are you working with a specific license board? What are you working with? How do you do this? And so when we think about AOE, we're thinking, okay, we've got a skill set, we've got a knowledge base, we've got techniques. How do we get that into the hands of therapists? Because if you also think about it, right, like once a therapist is done with their education, they're done. And most therapists, the therapeutic workforce is very old. So psychiatrists in particular, so this isn't all therapists, this is just MDs or MDOs. 55% of psychiatrists are over the age of 55. So the therapeutic workforce, when they look at gamers, when they look at 18 to 24-year-olds, you have that classic boomer zoomer like clash, right? And so that lack of empathy in the therapeutic workforce is really challenging. Furthermore, I think it's 70%, I don't quote me on this stat, but it's the vast majority of the therapeutic workforce is female. So working with young men is not in their forte. Like therapy was not developed for men. Therapy was developed for housewives. Like if you look at the history of like Freudian stuff, it was usually housewives laying on a couch saying I'm bored, and the diagnoses were like hysteria and stuff like that. Like it's a kind of a misogynistic, very paternalistic field. Historically, and a lot of that is changing. But if you think about, okay, there's a youth mental health crisis, there's a male mental health crisis, suddenly it all makes sense because the therapeutic workforce itself is not one-to-one, which is why peer works so well. When you have that same common shared ground. And so there are things that you can learn, even if like I'm a middle-aged woman, but I feel that I can talk to an 18-year-old man a little bit better now that I know what I know than if I had never ventured into healthy gamer world. There are skills, there's knowledge base, there's techniques to this that can make anyone more effective at working with this population.
So at a basic level, it's, hey, I'm a gamer, right? As you can see on our gallery here, if you're in gallery view, and our audience will be, we don't look like that stereotypical gamer, right? Especially, you have people who are in the boomer population will describe in the stereotypical way of a gamer, right? We don't look like that, but here we are, right? So the evidence is clear, and what you're saying is basically, if I'm a gamer, right, and I go to try to get some help, that person's not going to relate to me, right? Not only in my industry, but maybe to my demographic, and you're trying to solve that. So your message is basically, you're a gamer, you're in the industry, you have help now of people who will understand what you're going through, right? And you can get better help that way because we are you, right? Okay.
Absolutely. I think that that's right on. The definition for what a gamer is so much more expansive now than it was 10 years ago. And there's so much more validation around peer support models now than there was 10, 15 years ago. So things do get better. Things are looking up. There's a long way ahead of us, especially thinking about the veteran population and how many bureaucratic challenges there are there. But I think just from a simple, can the labor force match the issues of the clientele? I think we're getting better.
That's great. Kyrie, go for it.
So while therapy does not have to take place in a therapist's office, when you do get to that point and people make that big leap, I think a lot of gamers kind of shoot themselves in the foot because like they don't try one game and then pick it up forever. Like most of the time, they try one game and then another game. They might try an RTS and then a shooter, and then until they find what fits them. And they need to keep that in mind, I think, when it comes to finding the right fit for your therapist, psychologist, psychiatrist. I had to go through, I think, 4 before I found one that I could even begin to open up to. So, it's not a one size fits all too. So that kind of goes against the ratio even more so.
Very common.
Absolutely. And kind of what you were saying, right? Where like, people that are in the armed forces are just humans. So are therapists, right? And it's what I think we kind of cede a lot of control, a lot of autonomy to like the white coat, or just like the guise of being somebody that's licensed there to help you, but they don't have all the answers. And navigating towards right fit it's just like any other kind of match, right? You want the right person that's going to cut your hair right. You want the right personal trainer. You want the right doctor. You want the right therapist.
What in y'all's experience, what's the best way to narrow that down? I mean,
Yeah, that's such a good question. Like how to find the right therapist. Well, I've fired 2 therapists myself because there was no end in sight. I am wary of anyone who has a perverse incentive of like, keep coming back week after week. That'll be $150. That'll be $250, please, right? When your incentives are not aligned, I think no wonder we don't have great outcomes all the time, right? Like no wonder there's no consistency. So to me, to narrow it down, I think it was, can this person help frame what's going on, and can this person help develop like a plan of action? Because that's what I was looking for. I wasn't looking to be there week after week. So if that's what you're wanting, I would be upfront about that and say like, hey, I don't want to be doing this forever. I'm hoping we can get to some resolution, 3 months, 6 months. How long do you think it would take? And they'll do an assessment, and to be fair to them, they might say, well, give me 2 or 3 sessions and then we'll see if you can swing it. I think it's a fair kind of exchange. But trust your gut. If you're like, this is not going anywhere, let it be. Most therapists will do a 15-minute like complimentary just consult for like, can we just talk for 15 minutes and see if this is a good fit? And then you can ask them, like, if you're specifically looking for, okay, I have a lot of trauma, can you help me work through PTSD? Do you have experience working with PTSD? If you want to come in and, if the pushback is, well, how do you know it's PTSD? Do you have a diagnosis? That's not your therapist.
Right.
Right. If somebody's just like, oh, let me make sure I can manage this diagnosis as opposed to the person behind it. Personally, I don't like working that way.
Ken can attest to this probably, and maybe Bilal too, and to some degree, and probably April. But like, if you're out in the field, one of your battles gets shot, you're going to hit them with morphine, but that's treating a symptom, not the source. You still got to get to that bullet wound and triage it, or they're going to bleed out. And symptomatic treatment is what I see a lot of in a lot of places, where it's that see you next week kind of mentality, where I'm all about treating the source. Let's get to the root of that problem. Shrek said it best, man. People are like onions. You just got to get to the center of that onion. And that takes a lot of work.
And it's very difficult to do because the way things are framed in academia, it's always, let's look at the categories. You look at the DSM-5, open it up, okay, you fit right here. Let's treat that. Here's an algorithm. And then let's send that over to insurance, right? But it's so algorithmic, and we know the mind is more complex. We know the body is more complex. And when you put the two together, I mean, there's, like you said, onions, there's layers and layers upon it that are just not easy to distinguish just by giving that quick, easy treatment. You see there's a lot in the VA. I mean, in my experience in WarriorGMR, I heard a lot of folks just say, yeah, I went to the VA, here's what they gave me, and they just sent me home. That's it. I mean, what's going on there? We're not treating the demand. It's absolutely ridiculous. And despite that, I mean, there's still a big need for it. And despite there being a big need for it, there's still a lot of misunderstandings, especially within the gaming population. If you told somebody there is a mental health epidemic, probably the first thing that comes to their mind is, oh, there's abuse of fentanyl on the streets. Probably, oh, there's a high suicide rate. But not many people think about some of the subclinical aspects that you were talking about, the loneliness, the inability to navigate their career, the finding of purpose, right? So Healthy Gamer did a really good job at navigating these and explaining them to a general population, and by extension, academia. How did you navigate these misunderstandings?
Well, I think you nailed it, that a lot of times we're trying to back end into insurance bill codes. So as long as you're operating in a very regulated environment where you have to check boxes and because you could, even if we did check those boxes, an insurer would just deny the claim and say, and you got to go through the paperwork circus, right? So the way we wanted to imagine mental health was solving for 3 things, primarily from this labor force issue, that mental health is too expensive, it's old or outdated, and it takes too damn long. There's got to be an end in sight. So the way we kind of boil it down is it's too old, too expensive, too slow. And so when we imagined it, it was what can work in weeks, not years, what can be in the tens or hundreds of dollars, not in the thousands or 10,000s of dollars, and what can have an endpoint. So when we designed our coaching program, we started it in 8-week increments, and we put things on the GAD-7, the PHQ-9, or the generalized anxiety you're gonna have to help me out with the scale names.
Generalized anxiety disorder, yes.
Yes, generalized anxiety disorder, 7-question scale, or the patient
Patient health
healthcare.
questionnaire.
That's at the PHQ-9, which is a 9-question depression questionnaire, which, fun fact about the PHQ-9, so the PHQ-9 is like how we talk about depression. When we talk about improvements in depression from antidepressants or things like that, it's measured on this 9-question scale. It's not like people are testing your brainwaves. It's like, it's a 9-question survey. Guess who owns that survey?
Ooh, wait, I know this. Hold on. No, it's on the tip of my tongue.
Jordan Peterson.
I wish, honestly. Pfizer. Pfizer owns this survey.
That's it. Yeah.
And guess who designed the PHQ-9 at Pfizer?
That I don't know.
Mid-level marketing manager who was just trying to help doctors understand when to prescribe antidepressants. So a mid-level marketing manager at Pfizer designed the questionnaire that has somehow become the gold standard for how we measure and talk about depression. Talk about perverse outcomes, right? Or perverse incentives.
I can tell you how that happened. Oh, I'm sorry. I thought it was.
Go for it. I mean, like, yeah, I mean, it's very predictable, right? Like how we kind of got here from very like pharma heavy, insurance heavy system. So for us, it was, how do we operate outside of insurance? How do we make this just between the coach and the client? Because coaching, peer coaching became the model that we thought could have an endpoint insight, like removes that kind of generational barrier to people. The labor pool is affordable. It's not like people that are hundreds of thousands of dollars in debt and therefore have to have prices up to here. So that's how we solve like the labor problem and the kind of regulatory problem.
Little fun fact on that. Go ahead, April. Go ahead.
Oh, no, I was just going to say, I think that's fantastic. And I was wondering if you're using, not alternative, but folks like Joe Dispenza who measure brainwaves and have like a whole different scale to acknowledge growth and progress, or rapid eye movement, or some of the alternative treatments that don't necessarily have a code, but have a ton of people who like just stand by their results, by their personal results.
Yeah, so I'm not super familiar with kind of some of their methodologies. From the outside looking in, I think I understand more the necessity for some of these individuals to come up with their own way. And I think there's a lot of scrutiny, rightfully so, where it's like, well, if they're doing it that way, but everybody else is doing it this way, maybe the thing that they're doing doesn't work in like the traditional way. But I would argue that a lot of our traditional assumptions are pretty flawed. They're too boxed in, they're too symptomatic, they're too for the benefit of insurers and pharma companies. If you look at where healthcare dollars have gone, right? Like you have United Healthcare posting like, I don't know, double-digit billions in profits, right? And in the meantime, physician compensation has stayed flat for like 25 years. So doctors aren't getting paid more. I know, Bilal, it's going to be rough. It's just so clear where the money is going, right, in healthcare. So I think there's a lot of opportunity in reimagining a system as long as it's not designed for healthcare, for those players in healthcare, the insurers and the pharma companies.
That system runs deep, like all the way to the 1800s. The Rockefellers had a huge influence on that with their petrochemicals, leading into the huge push of modern medicine, making like anything else with efficacy, basically looked at as quackery. But there's efficacy in all these other methods. There's proof in it because I'm still existing. There's efficacy in having someone that says, I'd rather hear about your story than hear about your funeral. I mean, there's a lot of ways to save a life beyond symptomatic treatment. Bilal, the 5 WHO questions, the World Health Organization questions, are you familiar with those?
No.
Jamie, pull that up for me.
Yeah, pull that up for me. I'd like to see what these questions are about.
We're going to implement this. So Dr. Droz put us on this. Who was involved? What happened? When did it happen? Where did it happen? Why did it happen? How did it happen? 5 W's and H questions. That's the basic breakdown of it. But I was going to see if you guys had any insight into using that model as far as the what you guys just said one, and I hate that I forgot which one it was. I think it was the PHQ-9
PHQ-9, yeah.
or the generalized anxiety, one of those, or the DASS. That might have been what I was thinking, but those are lengthy. Whereas the 5 who questions can get, a little shorter synopsis. I mean, especially with like our veteran entities here. A lot of veterans don't want to be bothered too much. They just, especially if they're getting to the point where they're finally reaching out, they don't want to be inundated with 40 questions of how you feeling. And to tie it all back to the point here, that system runs so deep. How do we change it?
You know what's interesting? I'm going through the out processing. So I'm entering in the VA, I'm exiting out of the DoD, and I'm going through all of this right now. And like I have to go through the psychological assessments and all this stuff. And I will tell you, it drives me crazy to go through the process because I hate it. First, a stupid questionnaire. Like every time it's the same questionnaire and ask me the same things of the issues I've gone over the past 2 years. Like, don't you people like, is there a database? Like it's the same answer because it's the last 2 years. And like, I got click the buttons. And I'm just like, oh my God, it's 20, what year is it, people? Like, this is ridiculous. And I'm interested, Kruti, if that is the user experience, right, in gaming will kill your game, right? I mean, it's the entire game is the user experience, and apps are learning that, websites are learning that, but this whole psychological and psychiatric industry, I'm just like, have you guys left from the printing press? Like, this is awful. So is that something that you have identified as like a key barrier to entry, people getting help?
Totally. So there's like, a user experience product kind of component to making sure people feel understood and heard and supported throughout that process, because there's also such a lag between the time you sign up sometimes and your first appointment with the VA or a therapist or whoever. So we do a lot of cultivation between like, all right, you've signed up. Here are some things you can do right now. Here are some videos you can watch. Here's some material you can go through. Here's the Discord where you can connect with other people going through the same thing as you. So that kind of like minute one, day one experience for any human service is like a complicated logistical thing, right? But there's other things that a platform can do to help facilitate a good experience. But I think what you're describing, when a system is overburdened, they're going to not care about the user experience. They're going to want people to drop off because it makes their jobs easier. And there are people, executives from insurance companies, like on the record in earnings calls and stuff like that, saying like, just deny the claims. Like eventually people will give up. They'll just pay it themselves and this will go away. So there's very much a systematic disincentivizing of people utilizing services that they are entitled to or have paid for or should be authorized to use. But if we make it hard enough to use those benefits, maybe people won't use them, and then that system wins.
That's disgusting. But
Really
if
is.
there is a ship and we're all part of this ship that is our country or our system, and then there's holes in that ship, people like all of us here are the ones patching those holes to make the ship still sail. It's just like you said earlier, it's just a long battle before we reach shore.
Yeah, I think it's hard to be in this industry and not be optimistic, because if you're not optimistic, it'll just chew you up. But I am seeing some change. So for example, of all of the things that this Surgeon General could have focused on, this Surgeon General focused on mental health, which I think drew some ire because there's a lot going on right now for the state of health in America. Not only that, he focused on youth mental health, not only that, like wanting to hold technology companies to account. But I think the insurance companies are extremely powerful. The pharmaceutical companies are probably even more powerful. So it's gonna be a policy, a political thing that I don't know if I have the answers for, but if people know what's going on first of all, then I think they can make better informed decisions.
There's more of us than there are of them.
Well,
Goodwill
I'm not
prevail.
sure that people know that, like, hey, if your claim got denied, it wasn't a mistake that somebody made. It is, they are being paid to make that mistake,
Right.
right? Like, this is the process. To file a claim isn't just this paperwork, one and done. Like, this is going to be something that you're going to have to leverage. So sometimes what I'll tell people is to make sure that they understand their out-of-network benefits, because that can be an easier process. It's more expensive, but you're out of network. So all you're doing is say, hey, insurance company, I paid this much money, put it against my deductible, put this against my deductible, put this, but I'm gonna get the care that I want in the way that I want it. It's not a
Interesting.
perfect solution, but you're out of network benefits.
It's huge.
Yeah.
So if I'm not a veteran, if I'm just not just, but if I'm a civilian, no insurance, and I'm like, I'm not doing good, but maybe I've got like the Obamacare or something, so it doesn't have like the greatest coverage. You can just go and get like the best, if you can afford it, the better care, and then just say, hey, here you go, insurance.
Yeah, so you would want to understand, first of all, whether mental health is covered in your out-of-network benefits, and there may be some documentation you need to do, like have your primary care person say this person needs extra benefits. After COVID, a lot of those requirements were dropped because there was so much scrutiny on insurance companies to make sure that mental health was supported. So some of those plans still have that legacy from COVID, and some of them have been like, okay, well, that crisis is over. We're going to repeal that. And so it's back to kind of status quo. But depending on it, you may or may not need to have like a pre-authorization to access mental health benefits. And if you don't, most don't, I think at this point, then you can essentially say, here's the mental health care I got, here's the bill, put it against my deductible.
Here's the PSA that I tell people is, and you can Google this, you can see what Mark Cuban's doing it. The company I'm joining is doing this, is a lot of people are abandoning this medical insurance whole industry thing. You do not need a doctor's referral to get help. You do not need insurance to get help. Matter of fact, many times, if you do not have insurance, the cost of care is cheaper than if you had insurance, because you're paying that every month. You're paying deductibles, you're paying copays, you're paying all this nonsense. And non-insurance costs are many times cheaper than going through the insurance, because they don't have to do all the billing. They take the cash or the credit card right up front. So for me, I think, and Kruti, I'm very interested in your thought process on this, is I think in a few years, shockingly fast, that there'll be more people who are just like, what am I paying these people for? Like, to deny me, go through all this pay. They're sending me mail. Who does snail mail anymore, right? Deny me. I got a call. I sit on the hold for 90 minutes. What am I doing here? Right? Like, what's your take on that? Because I'm all for it. Like, I'm paying out of pocket. I don't care. And I go to wherever I want to go. I go to the best people, and that's it. What do you think about that?
I think it depends on your risk tolerance and how healthy you are. So if you're pretty healthy and you can swing, like, okay, I got into a car accident and whatever, like if you are comfortable saying living with that risk and that amount, that makes sense. I've got 2 kids, and when you got kids, things just look scarier, and so your risk tolerance goes way down. And that's, I think that's kind of the trap, and a lot of the kind of psychology around insurance, right? Is when people do have kids or mortgages or whatever, as their risk tolerance goes down, they get to charge more.
Yep.
It's also difficult considering how expensive those acute costs can be. I
Yeah.
mean, I'm in the hospital doing my rotations, and We order an MRI for a patient, they may be slapped with a bill of 1,500 minimum. I mean, you hear about the amount of people who are one health scare away from going bankrupt. You're in a difficult spot right now because on the one hand, if you pay out of pocket, you're screwed. On the other hand, if you pay for insurance, you're screwed chronically, but at least you'll be safe in an event something happens. And it's a lose-lose almost. Like
Totally.
pushing, yeah, it's just pushing against because what we're doing, I mean, at least the way I see it, Healthy Gamer, what they're doing, they're not just trying to patch the holes on the ship, they're trying to go the other way. But there's so many obstacles in the way. I mean, what sort of I'm curious, like, I mean, it's so difficult, just me picturing this. But I mean, you have a master's in public health, as I understand, right?
My partner does. He's
Your
a
partner does. Okay.
MD-MPH. I'm an MBA.
Okay.
Yeah.
Okay. And so my wife does actually. She talks to me a lot about this. And it's hard for me to wrap my head around the barriers,
Yeah.
that we have to do in order to, I guess, dismantle the industry as it is, because that's basically what's needed. And what do we need to do? Where are we at in that process? I mean, we're probably pretty early on. There's still a lot to go, but where do you think we're at in this process, and how can we keep pushing forward?
Yeah, it's a really good question. So there are a couple of levers to this. So what Ken was describing is like if you go a concierge medicine route, the level of care you get is outstanding because the person who's paying for the care is the customer, as opposed to the insurance company who could care less what the customer experience was like. Right? So when the value is just between the provider and the customer, that's when you get the best outcomes. Like full stop, right? So how do you remove the middlemen from the picture? There's more than just the insurance company in the middle, right? There's regulatory stuff. There's if you're a student and you're on your university health plan, there's like access stuff. So to me, the number one thing that would help with mental health in particular is removing state licensure. So if you're somebody in Kentucky, you should be able to see a therapist in California. All therapists want to live in California because they pay the best, right? So you have all these like deserts or like mental health deserts is what they call them, right? Where you have less than one psychiatrist per county, you don't have access. So if you could leverage telemedicine and just remove the state lines, that would be like a number one accessibility thing.
Does anybody know why it is that way? The state lines, like, what
Yes.
is a Georgian different from a Californian?
Well, they get to implement abortion restrictions differently,
Oh,
right? So states want to be able to control health policy.
Yeah, it's in the Constitution, unless there's a federal law that's been passed that blankets the whole country or an executive order. It's the entire Constitution and the Supreme Court has ruled like states' rights,
Right.
states' rights that
States'
allows
rights.
people to move into the state that gives them, their best benefits for who they are.
But I'm not a lawyer, obviously, but I think if you were to regulate healthcare as interstate commerce, that changes things a little bit. But it's a big, deep, yucky, non-sexy political thing, right? So you have
I'm
to
here
have
for it.
people. I know it would be so nice if we could do actual policy work instead of fighting about the same stupid crap for 10 years.
Yeah.
I
Somehow
think
I've
one
already been
thing
behind one. Go ahead, April.
I was going to say, I think one thing that you guys are doing that I just absolutely love is you're giving people alternatives in that gap, in the time between, yes, I recognize I have a problem, and yes, I need some sort of help. And one of the other things that people can do independently is often they can put aside just money that's non-taxable for healthcare in there. And people often don't know that if they're just working a regular job, you can, you don't have to be taxed at this crazy rate for healthcare. The other thing I think that you guys are doing that, and Kyrie as well, with our Discord. I think Discord is that's the means that gamers will use to actually open up, and having like robust Discord channels and robust things to do on Discord. Like you your physical problems go away when your mental health is better. And your mental health is better when your community is solid and strong. And that's what Discord does for gamers who are young and who are male and who are often, isolated and, forced to show that bravado, even though they may be feeling horrible. So I congratulate you on that front. And I would ask, what do you think you can add to your community to sort of bring in more people? Like what are you guys doing to bring in the numbers?
Yeah, it's really interesting because more people means less, like you're back to being one of a million instead of being like one, like you kind of lose that intimate community feeling the bigger you get. So that's a challenge that we've been working through. One of my favorite things that we do is called Social Sandbox, and this is how people who feel like they've atrophied their social skills or have just been in environments where they don't really need them or have gone through things that are so earth-shaking to them that they don't really know how to be with like regular people anymore. So Social Sandbox is where you learn how to introduce yourself with a smile and confidence. People on Valentine's Day, they practiced asking each other out.
That's so
They
sweet.
will, it's just you're kind of working on your IRL skills a little bit because they do atrophy when you're communicating exclusively online. So I love Social Sandbox. There was they'll clean their rooms together because cleaning your room is annoying. And if you're doing it by yourself, like there's no accountability, right? But if you're on a Discord call with a bunch of other people all over the world that are also cleaning their room and just saying like, should I keep these jeans or should I throw them out? Let me put them on real quick. What do you think? Like stuff like that. It's just so much more fun. So I
That's
think
family.
yeah, right. It's really it's really lovely what connections Discord can foster. And I think um when we think about alternatives, what we're really trying to do for people is create that sense of agency and purpose. So a lot of mental health stuff just comes down to, can you move from being stuck in the bad to looking forward to something good, right? So if we can help people look forward to something good, feel like they are empowered, that they know what steps they can take, that they know that there's people behind them, that they know that it's so cheesy to say that they're not alone, but not only are you not alone, here's your tribe. They're right here. I think those are the kind of concrete steps that people can really take as opposed to this abstract once a week talking to an empty room. It can feel like in therapy, right? Therapy's, I'm not here to knock therapy. I'm here to say there's so much more we can do, and mental health isn't just mental illness.
That part.
Fantastic. Thank you.
Yeah, and one last note before we go, we'll get everyone around the circle here. But like all the care, like I mentioned, my traumatic brain injury, right? Like my restoration to who I am today occurred outside of the military medical system. I hired all of my own people, to include my coaches. Like I went from psychological assessment and all that stuff. I was like, I'm not getting anywhere with these people. So I hired a Tony Robbins coach, and that was like a like huge difference. So like what you're doing is so important, and I'm urging anyone who is listening, who is watching, check it out. Check out Healthy Gamer. Go to the website, get connected with what they're doing, and like move toward that direction of taking care of yourself and get the solutions no matter what. So that's my pitch on the way out of Warrior Gamer here. So
Following
right
up
around the
on that.
corner.
I-
And thank you so much for sharing that story of yours too, because when you look at you, you seem like you've got everything together. And I think that can be one of the most isolating things where you're looking around and everybody looks fine. So when you share things like that, I think it's really quite touching and motivating for people to be able to be like, okay, I can do it too.
I just want to
And
follow up on his and say that I can vouch for Healthy Gamer, and as far as like their vetting of people that they accept to be like even coaches, because I applied and I got denied, as I should have been. Now this was I don't know, 3, 4 years ago. I wasn't ready. I mean, I had the heart. My head was in the right place. And now there's qualified and certified. And I do believe I'm qualified. I am not certified by any means. And so Healthy Gamer said, thank you, but no thank you. And that's how it should have been, because it would not have been the right fit. So I just want to say that as a testament to Healthy Gamer and using myself as an example. Like for all intents and purposes, if I tried now, things may be different. But at that time, y'all made the right call. So I commend you guys for that.
I appreciate that so much, Kyrie. We take a lot of pride in, because ultimately it's just people from the internet, right? So we do take a lot of care to make sure that people are ready and they've got both the heart and kind of the stability in their own lives to be able to really make sure that they can give themselves to others. But I really appreciate that. I would love it if you play again.
I can try. It's busy,
Whatever.
busy, busy. I wake up every day looking forward to complaining about how much I have to do in Discord. Because if I didn't have Discord, like if I didn't have these people right here, I don't have any family to speak of. This whole thing was like a big negative for them. So if I didn't have my family in Discord, I'd have nobody. So I mean, it's the world to me.
Yeah, I get that.
it's a very active community too. I've been involved in that Discord for so long. There's always somebody in the voice chat. There's always somebody chatting. Yeah, you could throw a message at any second. Somebody's going to respond to you. So it's a really robust community. I just want to know, like, for folks like us who maybe want to get more involved. I know time commitment wise, I mean, I've just been nonstop studying before this, and I'm going to be going back to studying even after this. I'm loaded to the brim, but I still want to contribute. You know, what can folks like myself or anybody else here, if they want to contribute to Healthy Gamer, what can they do?
Honestly, our whole thing is meet people where they're at. So if people are wanting information, we have a ton of content. There's like over 1,000 videos in there. If people are feeling lonely, share the Discord. There's so many amazing souls in there, just like you're saying. They've been there, so they don't want to leave people hanging because they didn't want to be left hanging. And it's fun, right? So this is the other thing, like we always think of mental health as like sad, but mental health doesn't have to be sad. It can be funny, it can be ironic, it can be, there are moments of joy in the journey, like it can be inspirational. And a mental health journey doesn't have to just be tears and I don't know, just wallowing. It can be active, it can be proactive. So I would say just share resources, and I would love to talk to you guys more. Maybe there's a good collaboration with the Healthy Gamer Foundation. I would love to be able to advocate more for kind of the veteran community and the gamer
Yeah.
community that you guys work with. That would be really cool.
It'd be
What do you
awesome.
play? What do you play?
Right now I'm playing Super Mario Wonder with my kids.
Alright.
Before that it was Hogwarts Legacy. I'm waiting for them to expand on that, but I'm like a kid with my games.
Oh, we can show you the world. Don't worry.
That's so cool. And I think that's the best thing. Ken's got a fantastic story about playing with his son and his dad. And I think gaming is the great connector. It crosses cultures, it crosses ages, it crosses so many verticals that as Kyrie said, this is our family. This is not somebody you're going to let down. It's not somebody you're going to vanish on. It's not somebody you're going to ghost. The gaming community is so important to so many people, and this generation has grown up gaming. They didn't grow up playing in the forest and not knowing when they're going to come home like the boomers did. So really it makes sense to have them talk to each other. The peer to peer is so important that I can't emphasize it enough, and I'm so grateful that you are doing that with your platform. and I wish you all the best. And I guess my last question I always ask is, what do you think the future holds for you guys?
Hopefully a nap somewhere in there. Bilal, I hear you about like being up to your eyeballs. I think the future is pretty optimistic. We want to be able to collaborate more with therapists. I also want to be able to collaborate more at the community level. So conversations like this are very exciting. And then I think the biggest thing that we're trying to do, again, with that AOE theme, is we're trying to help parents through this whole thing, because I think a lot of parents operate out of fear, or they didn't grow up that way, so they don't know how to keep things balanced, so they either overcorrect or they don't do anything at all. So really working on healthy gamer families is probably the next big step for us.
Love it. I'll volunteer us. It's like April said, we have 4 generations playing like at the
That's
same time.
amazing. That's
Pretty
amazing.
awesome.
One day I want to have part of healthy gamer families, like my pie in the sky thing is, can we make a Discord server where parents feel good about their kids being like, this is a safe place? Can we monitor it
Oh yeah.
enough to where like the healthy gamer family Discord is fun? It's not going to be like lame, but like,
Yeah, there's definitely possibilities for that. And then, like with our youth that we have, there's certain channels they don't have access to because some things are
right.
adult conversations. But the Zoomer chat and the memes and all that stuff. Like if you want to fry your brain a little bit, you jump on in there for 5 minutes and see what the kids are up to. Come up over there like, hey, you want to go throw some bikes off a bridge? They're like, what are you talking about, old timer? That's how it used to be.
Yeah, totally. Well, thank you guys so much. This was such a pleasure. This was a very like emotional conversation for me.
Yeah.
So I really look forward to collaborating more and supporting you guys. And thank you so much for having me.
Absolutely.
Thank you for
Thank
being
you.
here. And thank you for existing, because without you and everything you guys do, there could be good people that aren't with us anymore.
Yeah, absolutely. And
I think
my
oh, go ahead, Ken.
oh, sorry. Yeah, my retirement ceremony is next month, and I have a list of all the people we've lost, all my friends we've lost over the years, and I can only imagine if we had all these resources, and we thank you, because you will save lives, and you'll never know. And there are probably folks who are tuning in now, and it does hit home. It does matter. If you're tuning in, please assist, pitch in, even if it's 1 hour a month or a year. It will help.
And if you're
And
hurting, reach out.
yeah, absolutely. Absolutely.
It
So
could be any age. That's what I was saying. I had 2 students die by suicide. And I think if they had what you're doing, it's almost, I don't want to say sneaking up on them, but you're saying get a coach. You're not saying get a therapist. You're saying get a coach. That's a whole different mentality. And I love that. I really love that.
Thank you. We do too. And you guys are going to totally make me cry.
well, just so we know, your healthygamer.gg, that's the website to go to. Just Google it. It comes up. They got pretty good SEO. It'll be in the show notes. Also, they have 6 different ways to connect with them. 3 of them are approved through the parent, right? It's on the website, bottom right-hand corner. Please check that out. It's also be in the show notes. Join the server, join all of their socials, give them the like. You will be surprised at how many people have already done that. They're very successful. We're very proud of them. And hopefully we'll swim in their wake for a while as we catch up. So pending any last rounds here, that'll be it for Warrior Gamer.
think we're good.
Well, wishing you well.
Thank you, Kruti. Thank you, team. Thank you for coming. Appreciate it so much. And Warrior Gamer out.
Thank
Warrior
you.
Gamer Headquarters Podcast. Out.